I will present together with my colleagues. So I have Gondwe. Would you want to show yourself? Thank you, Air. And we have also George Nkhoma that has joined the Zoom. George? Good. So George is around. So it will be me and Air presenting. Let me just share my screen now. So are we able to see the screen?
Yes, Hester, we can.
Thank you, Nisha. So we're going to present on our rollout and promotion of the updated RMC Charter, our experience here in Malawi. Now, just to highlight that RMC is key to our work in Malawi and is in line with our vision and our mission. Our vision is to see all girls and women realize their rights to quality health and well-being. And definitely we cannot achieve that if we leave out respectful maternity care in the mix. And our mission is to activate a people-led movement for reproductive, maternal, and newborn health and rights. And that's where we bring in all the key players, service providers, academia, civil society organizations, that we all work together. And one of the areas that we're focusing on is to ensure that we're providing optimal support to our women and girls and the newborns in the respect of respectful maternity care. Because of that, White Ribbon Alliance welcomed the updated RMC Charter and would like to thank all those that were involved in this work, because definitely we need to highlight the rights of the newborns as well. And this was a great milestone, moving from the previous charter that we had. And being convinced that this was a very good move to have the updated RMC Charter, we engaged the Ministry of Health to have the updated charter approved and went through the processes, which I'll just take you through. So the first part, we met the Director of Reproductive Health with our team, presented this updated charter and had a discussion around it, why the shift and why we have it now in this form. After several deliberations, the Directorate found it very good, and they gave us a go-ahead to present this to Safe Motherhood Technical Working Group that advises the Directorate on new information, new policy issues, or even new programs that are coming in the country. So we presented that in November 2020, and we're glad that we got the approval from the technical working group. And from there, that's when the Director of Reproductive Health Directorate had now to go to the senior management that is chaired by the Secretary for Health, and presented the charter. The senior management team comprises all the directors in the Ministry of Health and other senior members of the ministry. And in November, they also approved the updated RMC Charter. And this year in January, on the 8th of January, that's when the charter was launched by the Minister of Health, Honorable Kumbize Kandodo Chiponda. She's the one on the left, and on the right in the picture that is there is Dr. Ursula Kafulafula. She's the Vice Chairperson of White Ribbon Alliance, Malawi. So we're happy that Malawi has adopted officially the updated charter, and that's the one that is in the discourse in the Ministry of Health. But just to highlight also some of the key issues that came out from our engagement meetings. So the first one was a recommendation that we should have the charter translated into Chichewa, our local and national language. The idea behind this was that most of our women are living in the rural areas, and we have a good considerable proportion of women that are below the poverty line. And it was felt that there is need to communicate this charter in the language that most of the women need to understand, and that when their rights are violated, they will be able to take up the issues themselves. So that was one of the key recommendations we got. The second one was a recommendation that as we're promoting RMC, we should also highlight the rights of nurses and midwives. Key indeed during this time of COVID, where we have seen a lot of nurses and midwives being abused, both physically and also verbally. And in Malawi, we just have a case in court now where two women, very courageous, stamped on a midwife because she had just told them about the COVID restrictions that are there. So definitely, this also came out as a very strong recommendation that we need to ensure that we also highlight the rights of nurses and midwives. And there was also a recommendation that now that the charter has been updated, we also need to update the curriculum in the in-service training institutions. So these were the key issues that came out from our engagement meetings. But also to highlight some accountability issues and commitments that came in the launch and the rollout of the RMC Charter. So the first is the commitment that the Minister of Health made. Number one, she indicated that her ministry will ensure that they will uphold all the rights of women and newborns. We felt this was a very strong statement from the minister, and would be indeed great to take her to task on that. The second point that she also raised was the need for the ministry to recruit more nurses and midwives. We're not lucky enough that she didn't give in the figure that she anticipates to recruit, but we felt this was a good start. And she indicated that the process, the recruitment process, they will start with those nurses and midwives that are already working on temporary basis. And we felt this was good because she was also recognizing that one of the challenges that nurses and midwives are facing for them to provide optimal service is because they are understaffed. And Malawi, according to the documents, we're looking at 46% vacancy rate in the ministry, which is quite high. So this was a very good statement, and it's good that the minister also committed to recruiting more nurses and midwives. And she also committed that she will support dissemination efforts to ensure that all the health workers are aware of the updated charter, which was also great. We got another recommendation from Kamuzu College of Nursing. It's one of the big institutions that we have in Malawi that trains nurses and midwives, that they will indeed review the curriculum for the nurses and midwives in line with the updated RMC Charter. And we're just going to support them in that process. So just to highlight about the translation of the charter, that we have gone through all the processes, and this is a process that you have to go through in Malawi. Firstly, we engaged the Health Education Services Department in the ministry to lead in the translation process. We came out with the draft Chichewa version, At first, we thought it was going to be an easy way, but to have the same meaning of a right in Chichewa, you need to really take time and put in a lot of effort to get that done. We went to the community to protest. They had to panel beat here and there in terms of understanding, but we're lucky that was done. We presented again to the Safe Motherhood Technical Working Group, and we're lucky and happy that it was approved. Now we are now in the production phase of the posters, and we ensure that these posters and the messages are sent across all corners of Malawi. Reaching this far, I will now invite Gondwe to take us through what we have done in promoting the charter so far. Over to you, Aya.
Thank you, Hester. So after successfully translating the RMC Charter into our Chichewa version, we decided to roll out in terms of promoting the charter through our social media platforms. Firstly, we are on Twitter and Facebook, and as you can see on the slide, these are some of the examples of the messages that were shared on our social media platforms. Next slide. Hester, next slide, please. Thank you. And then we also had radio programs where we also sought to promote the charter. And we had a panel discussion and phone-in program where we sought to involve some major stakeholders. That's representation from the Ministry of Health in the Reproductive Health Directorate. We had a representative from that side. Nurses and Midwives Council, who are a regulatory body regulating the nursing and midwifery practice, were also present, as well as a practicing bedside midwife was also present. We had these representatives, including, of course, the program officer for Malawi, WRA Malawi, Mr. George Nkhoma. Why we involved these representatives, because they have different roles that they play. For example, the Nurses and Midwives Council regulate the nursing and midwifery practice and are able to get complaints from the communities and act and provide action on those complaints. And Ministry of Health, Reproductive Health Directorate provide an overall oversight role in terms of guiding the policy, as well as the midwife to come in and bring in her experiences of what she's seen happening in the health facility and how best to respond to questions from the participants. So key outcomes from this conversation during this panel discussion, the first thing that we observed was that there was more participation from the men, which was quite exciting because now men are involved in all these issues happening in the country. But we also sad that we didn't see a lot of women participating in the conversation. And secondly, we also saw some clients commending the good work that is happening in some facilities across Malawi in terms of the provision of respect for maternity care to our mothers and newborns, which was also exciting and motivating in a way. But we also saw complaints of cases of disrespect, as Hester earlier said, midwives shouting at mothers during labor and delivery, but also neglect in terms of midwives not using their phones whilst they're in the process of providing care, which was sad to note. But what was also interesting was seeing the audiences trying to ask questions on if we face these challenges, where do we report to? So this was an opportunity for us to introduce to some of the community members that are not aware that in Malawi currently we have the Office of the Ombudsman, and we have a representation of this office across all health facilities where community members, if they experience some disrespect, some bad treatment in the health facilities, they can go and report to these offices and issues will be dealt with at that level. If things fail, then they can go to another higher level. So that was quite interesting to note during this conversation. Next slide, please. So some of the challenges that we observed was that because we saw when the audiences were calling in, majority of the callers were men. We saw that there was a limited participation of women in the normal radio programs. We've just today we had another radio program, and we've seen that I think it's important that we in future we take these programs to already existing special women programs around on other radio stations as well, just to see the more active participation from women, because basically the RMC Charter, the women are the major beneficiaries of the Respect for Maternity Care Charter, and we hope to see more involvement of the women. So as going forward, we hope that we engage more women through bringing these programs in the special women programs. But we also saw that there was restriction in terms of COVID-19 restrictions that came in, that we were unable to engage communities directly as well as physically. So that was proved as a challenge for us, because we could have gone to those communities just to share the RMC charters and have further conversations on this, which we're not able to. We've of course managed to use our volunteers as well as the chapters that are already in those areas to disseminate the Respect for Maternity Care charters. But we hope that going forward we'll be we'll start engaging when the restrictions become a little loosened a bit. So those are some of the things that we faced. Next slide, Hester. So the next steps, as my colleague Hester has already alluded to, is that we intend to print posters and leaflets so that we can share and disseminate in the health facilities across the country. We hope that with imprinting those posters and leaflets, health facilities will be able to post them on the walls, and community members will be able to read out what are some of the rights that they can benefit from the health facility. But also we seek to engage more with the community members through our volunteers and chapters in future, so that we are sure that community members, even at the grassroots, are aware of their rights in the communities. But also we in the process of developing radio jingles that we want to roll out in radios across the country that can reach to those grassroots levels, that can reach in the remotest areas, so that people and community members are made aware of the rights of Respect for Maternity Care Charter. But also looking forward to the training institutions reviewing the curriculum in terms of incorporating the Respect for Maternity Care Charter into the existing curriculum that they're using at the moment. So much that they provide this training, in-service training to the students that are in colleges, so that as they come out, they are really aware of what they're supposed to do as they provide care to our mothers and newborns in the health facilities. So reaching this far, thank you so much for your attention. Thank you.